One of the areas that really is important in the management of myeloma is for patients who have relapsed. They've had one prior therapy. And the narrative that's emerging is that triplet therapy does better than doublets or monotherapies. And so the question really is, what is the best triplet in this space of patients who've had one prior therapy? So we heard an update from Dr. Dimopoulos, who's from the University of Athens, on a large trial, phase 3 trial, comparing the triplet of Daratumumab, Lenalidomide Dex to Lenalidomide and Dex. And this was an updated analysis with a median follow-up of 33 months. And what we found or what's there to report are two important things. One is the PFS for the DRD arm still hasn't been reached. So really a remarkable long duration. We also learned that for patients who relapsed in that arm, there was no shortening of their subsequent responses. Their responses were the same as patients who were on the control arm. And we also learned that there were more patients that actually achieved MRD negativity. Now, for patients who are already in a relapse situation, the fact they can get to MRD negativity is quite remarkable. And in this study, about 30% of patients were able to do that. So, and finally, importantly, there really wasn't any new safety signals of concern. It was the sort of anticipated cumulative hematologic toxicities, no concerns about second malignancies. So it was encouraging and again supporting the concept that this is going to be a powerful triplet going forward for years to come. I think it's definitely going to move the needle just because of the remarkable benefit for PFS and again this signal of MRD negativity. Right now we have limited access to Daratumumab, but clearly using it in this triplet situation is a very powerful thing. In general, in both CLL and myeloma, we are now starting to move to a point of looking for minimal residual disease at a very sensitive level, 10 to the minus 4, 10 to the minus 5. And clearly that is the step. The next step after that is cure. So getting to MRD with the studies we've heard about at this year's ASH in CLL with ibrutinib and FCR and with DRD and myeloma, we're well on our way potentially and hopefully to getting to the next level, which is curing patients.